make things move quickly throughout. This is live streamed on CTN for folks to watch after and share people who might be interested in collaborating with us. So bear that in mind. And hey, Kaylee, you're not on mute. I don't know if you meant to be. For folks who are joining, I'm going to go through a slide deck to sort of keep us on topic, but I'm going to start by introducing myself and my esteemed colleague, Rep. Dathan. So I am Rep. Jamie Foster. I am the state representative from the 57th House District of Ellington and East Windsor. I serve on the Public Health and the Children's Committee, I think relevant to the work that we're going to be doing here. But in my other hat, I'm a research scientist for the Yale Griffin Prevention Research Center. And one of the bills that languished after passing favorably out of the Human Services Committee was to create a food as medicine state plan. And Rep. Dathan and I decided to give it a good effort at resuscitation. And so we have convened this working group in attempts for trying to make those efforts that failed to get through the House and Senate chambers a little bit more successful. So I'm so grateful to everyone for being here today. We're going to go through a little bit of a slide deck and our agenda is scheduled, but I will let my colleague Rep. Dathan introduce herself. And I think Rep. Kennedy is joining us too. So we have bipartisan representation. So I'll let Rep. Dathan introduce herself and then we'll have Rep. Kennedy as well.
Thank you so much, Representative Foster. It's really nice to be here today. My name is Lucy Dathan. I represent Norwalk and New Canaan in the 142nd District, and I sit on the Human Services Committee as well as a Vice Chair of Appropriations and Insurance and Real Estate. And I'm here after learning about this topic in the session through my colleague Jamie Foster, who's done a phenomenal job of really elevating how important this initiative is for our state and for our country and for our world, really. It really boosts nutrition, it boosts people's well-being. And my hope is that we have healthier residents as a result. So looking through this through my human services lens, as well as my appropriations lens. And I know there's several articles that have been written about this topic in the last several months. And I encourage you to, if you haven't already, to do a little bit more work and reading those things. But Rep. Foster has done a great job of pulling together all the information that she sees, that she's come across and given us a wealth of information. So we all learn a lot. So thank you so much, Representative Foster, for bringing this group to fruition. And I'm glad to work with you and Representative Kennedy to come up with some meaningful legislation that we can take forward in the next session.
Wonderful. Thank you so much. I don't see Rep. Kennedy, but I know sometimes people's names populate differently. So when she hops on, we'll give her a chance to introduce herself. I'm going to start quickly by running through a little bit of what we're going to do through our agenda, which starts with introduction. So we're going to get there in 1 second. Sorry, I need to screen share. Okay, hopefully everyone can see the slide deck that we have presented. So as I think everyone on this call knows, we introduced a bill, House Bill 5337. It had very good public hearing support, and I am cognizant that this room right now is a little bit of an echo chamber. I think we all have vested interest in addressing nutrition-related chronic diseases and food insecurity and the intersection of those issues, but I'm grateful to everyone for being a part of today. So we have convened. And I'd like to start by going by introductions. And I am cognizant that it's always a little tricky to do these in this sort of setting. And so what I'm going to try and do is I'm going to try and call people off for introductions because I don't want people to feel like we're going to miss someone. So I'm going to go sort of left to right on my screen and hopefully catch everyone. So if you could say your name and your agency or professional organization and your role, and we'll try and keep this quick so we can get later to the actual content of the meeting. So try and keep it to 20 seconds. So first, Brent Miller.
Good morning, everyone. My name is Brent Miller. I'm with the Connecticut Office of Health Strategy. I'm in the Health Innovation Department and am the Community Health Lead.
Great. Thanks so much. Zani?
My name is Zani Imitowski. I'm with OPM and I'm a Policy Development Coordinator.
Thank you so much. Kaylee?
Hi, everybody. My name is Dr. Kaylee Royston. I'm the Legislative Liaison at the Department of Agriculture.
Thanks so much. Megan Smith?
Good morning. I'm Megan Smith. I'm the Senior Director of Community Health Transformation at the Connecticut Hospital Association.
Thank you for joining. Lonica?
Good morning, everyone. I'm Lonica Blackman-Carr, an Assistant Professor of Community and Public Health Nutrition at the University of Connecticut in the Department of Nutrition.
Thanks, Lonica. Claudio?
Good morning, Representative Foster. Claudio Gualtieri. I head up the Health and Human Services Policy and Planning Division at OPM. Thanks for having us.
Thank you. Heather Paracchio?
Good morning, Heather Paracchio. I'm representing the Connecticut Academy of Nutrition and Dietetics as their Food Security and Sustainability Chair, and I'm a registered dietitian. Thank you, Representative Foster.
Thanks, Heather. Nancy, Dr. Trout?
Hi, I'm Nancy Trout. I'm a primary care pediatrician at Connecticut Children's, and I also run the Start Childhood Off Right program in the Office for Community Child Health, which currently actually includes a produce prescription program that we've been doing with Cigna in the ED, which maybe we can talk about later. Thank you.
Thanks so much. David Seifel?
Hi, good morning. Dave Seifel with Department of Social Services. And just as an FYI, there will be others joining from DSS in future meetings, but I think some might be on vacation at this time. So,
Thanks so much for joining. Dr. Perez Escamilla?
Yes, good morning, everyone. My name is Rafael Perez Escamilla. I'm a tenured professor at the Yale School of Public Health, where I also direct the Global Health Concentration. And I run closely with my dear colleague, Kathleen Dufani, who is here with us today as well, the Yale Griffin Prevention Research Center, which is funded by the CDC. My background is in public health nutrition, and I do have 3 decades of expertise now in the area of household food insecurity in the US and globally.
Thank you
A
so much.
pleasure to be here, Jamie.
Thanks so much for joining. Claire Botnick?
Morning, everyone. Claire Botnick, COVID Recovery Advisor, Office of the Governor. Very pleased to be here. Thanks for convening this, Rep. Foster.
Thanks for being here. And I'm realizing as I'm about to make my next introduction that some of these folks I knew as mentors and some after, so I didn't acknowledge titles for some folks who were here earlier, doctorates that were earned. So I apologize for doing that. My next introduction is Dr. Goran.
Good morning, everyone. I'm Amy Goran. I'm the Interim Vice Provost for Health Sciences and a Professor of Psychology at the University of Connecticut.
Thank you. And Judy Dowd.
Good morning. I work for the Office of Policy and Management and the Budget Division overseeing the Health and Human Service agencies.
Thank you so much. Dr. Duffney.
Hi, I'm Kathleen O'Connor Duffney, and I'm Assistant Professor in Clinical Public Health at the Yale School of Public Health. I'm co-directing the CDC Prevention Research Center, and with a focus on nutrition along the lifespan and food security, and also PI of a produce prescription program.
Thank you. Jenny Hirsch.
Good morning, everyone. I'm Jenny Hirsch. I'm the Chief of Staff here at Connecticut Food Share, and thank you, Jamie, for bringing this group together. We're really excited to be here with you all today.
Good to have you. Thanks, Sally Mancini.
Hi, everyone. Sally Mancini. I'm the Director of Advocacy Resources with the UConn Red Center for Food Policy and Health. And the Red Center promotes solutions to food insecurity, poor diet quality, and weight bias and stigma through research and policy. It's really nice to be here. Thanks for bringing this group together. Rep. Foster, so many friendly faces and folks I've worked with through the years.
Thanks. Brian Cornier.
Good morning, Brian Kenori, Director of Government Relations at the Connecticut Hospital Association.
Thank you for joining. Jen Vincy.
Hi, good morning, everybody. Yes, it's so nice to see some familiar faces and also meet some new ones. My name is Jennifer Vincy. I work at the Connecticut Department of Public Health. My role is the health program supervisor of the Nutrition, Physical Activity, and Obesity Prevention Program. I know that's a mouthful, but basically we work on implementing policy systems and environmental change strategies directed at nutrition and physical activity within the state, and also oversee SNAP Ed program on implementing direct education services for Connecticut residents.
Thanks for joining. Mike Warner.
Thank you. Good morning, Representative. My name is Michael Warner. I'm the lead aging policy analyst for the Commission on Women, Children, Seniors, Equity, and Opportunity.
Thank you for joining. Janet Houghton, please.
Good morning. I'm Janet Houghton, and I'm representing the Department of Aging and Disability Services. I'm a nutrition consultant, and I oversee the elderly nutrition program for the congregate and home delivery meal program.
Thanks for joining. Brent Ling.
Good morning, everybody. Brent Ling, Chief of External Affairs at Wholesome Wave. Wholesome Wave is a Bridgeport-based nonprofit that's kind of founded SNAP Incentives and the Farmers Market Nutrition Program, and has been working to scale national produce prescriptions. And I lead our advocacy and external affairs, partner affairs, and also I staff the National Produce Prescription Collaborative in this role.
Thanks for joining. Stephen Hernandez.
Hi, everybody. Steve Hernandez. I run the nonpartisan commission of the legislature that focuses on women, children, seniors, equity, and opportunity. It's good to be with everybody.
And I'm going to ask Commissioner Hurlbert.
Good morning, everybody. Great to be here. Thank you, Representative Foster, for convening this. Brian Hurlbert, Commissioner of the Connecticut Department of Agriculture, where we do a number of food insecurity programs. Importantly, I chair the Food Policy Council, led the governor's efforts on food insecurity during the COVID pandemic. In a previous life, Brent, I was the national VP of Wholesome Wave for partners and programs. So a little bit of experience in this role. Good to see everybody.
Thanks so much for joining. And last but certainly not least, Representative Kennedy from the 119th.
Good morning, Rep. Foster, and good morning, everybody. My apologies for jumping in late. I got tied up at work. I am thrilled to be a part of this working group and looking forward to see what we're going to accomplish, and looking forward to hearing from our guest speakers today. So thank you for the opportunity to be here. I'm very, very excited. Thank you.
Thank you all so much. So I am going to try and get us through a couple of quick sort of groundbreaking things to make sure we're all on the same page about where we're going with this working group. So I'm going to start with a brief overview to make sure we all sort of are on the same page about what we're talking about. So what is food as medicine? There's a bunch of different states doing a variety of different things, but the term food as medicine has been used a lot in, I would say in the last 20 years or so, or 25 years. But since the COVID pandemic, there has been an unprecedented amount of attention on the fact that nutritional status, food insecurity, healthy food access significantly predicts disease outcomes and morbidity and mortality. And so in addition to diabetes, which has sort of long been a great public health concern for folks, that there have been a variety of different interventions that have been appropriate for, we are now also worried about the things that these nutrition-related chronic diseases make worse. So the COVID pandemic sort of shined light on our system's weakness. So the types of interventions that are counted as food as medicine are things like screen and refer types of programs that address for food insecurity and refer to community-based organizations and offer funding. Things like medically tailored meals, like the Meals on Wheels program we have representation for. Things like produce prescription programs, particularly those that incentivize purchase of healthy food items. And then things like the Farmers Market Nutrition Program or other fruit and vegetable incentives. And I'll just take a minute to make this distinction that I think from an outcomes-based standpoint doesn't necessarily matter, but from a policy standpoint, it does. Fruit and vegetable prescription programs are typically referred by a healthcare organization or medical provider, and the impetus is usually disease status or a risk for a disease status. but something that's a nutrition incentive program might be something that anyone is eligible for that's affiliated with an organization. And that affiliation with that organization might predict a higher risk of a disease. For example, if you are a member of a food bank or food pantry and your income is lower and your resources is lower, you might face a disparate risk of nutrition-related chronic disease, but not an automatic qualification like would be the case in a produce prescription program. A little bit as we talk about this, we're going to talk about food insecurity. And I do think since the COVID pandemic, most folks know what food insecurity is, even if that wasn't the case before. But when we refer to food insecurity, which is hopefully one of the goals to address when we adopt a food as medicine action plan or plan, is the lack of consistent access to enough food for an active and healthy lifestyle. And what is important here is health, because a lot of times, when people think about emergency food or distribution of food, they're not necessarily focused on the nutritional quality of the food that's being offered to folks. And then I'll just mention that when we're talking about diet-related diseases, there are a lot of diseases that are worse for outcomes because of diet status. For example, COVID, poor nutritional status definitely disparately predicts outcomes for COVID status, but nutrition-related diseases specifically refer to diabetes, cardiovascular disease, and the cancers that are related to diet and nutritional status. There's a lot of peer-reviewed evidence, and these tables here are from a colleague, Dr. Mozafarian here, and they tell us that fruit and vegetable incentive programs may contribute to people eating healthier food. And sometimes there is a reduction in the less healthy food. So not only do you get people having better nutritional status because they're eating more fruit and veg, but sometimes they're displacing those less healthy foods, the things that in the Healthy People 2030 goals, like foods high in saturated fat, added sugar, and sodium. Sometimes there's a displacement effect, not always, but sometimes. That there's often improved health metrics, and usually we look at hemoglobin A1C and BMI. And for those who are thinking about like costs of Medicaid, for example, those two indicators significantly relate to cost. And a variety of program structures show benefit. And that's why we have agricultural representation here, we have DSS, and we have DPH, because there's a variety of different ways that we can get an incentive to an individual that would all result in this benefit. Some of these from a dignity and experience of the person using the program are different. So like a token or a voucher or a coupon might be a different experience for shopping versus a credit card. And lastly, I think perhaps most importantly, and why this becomes something that I hope that there could be sort of unanimous momentum behind, is I think most people are motivated by improving health status of folks. That's certainly my primary focus here, is to improve the health status of everyone. But I think we can get a lot of buy-in, because not only do we see an improved outcome for the people who participate in these programs, but there's a benefit to taxpayers and consumers, because we can lower the cost of healthcare and we can increase the amount of money that's spent in a local economy. And you can target that local economy. It could be the farm economy, because you incentivize purchase at farmers markets, or you can incentivize an economy related to local grocery stores. Importantly, there's momentum here. So a lot of my colleagues who are on this call know this firsthand, that there's a mounting amount of scientific evidence that these programs are effective. There is a tremendous amount of health disparity in our system, and some of that health disparity can be explained by differences in nutrition-related chronic disease status, and we can lessen disparities by creating tailored programs like this. Some of my colleagues here have expertise in health disparities and addressing those. And never since the USDA started measuring food insecurity, and anytime I do this work, I always take a moment to mention that the evaluation of food insecurity in the US has been done by the USDA since the 1990s, but the tool was invented by a researcher named Dr. Radimer. That her work, her impetus for measuring food insecurity, that never has there been as much as attention as we have seen national food insecurity increase related to COVID and inflation and supply chain challenges. So there has never been a moment in time where the momentum is here as much. And then Connecticut's behind. And so I have my favorite bill person, because every time I talk about legislation, my brain still goes here, even now as a legislator. But many states are already doing this work. And there's a variety of different ways to make it done. Thanks to Wholesome Wave for sharing this infographic with me for this today. Brent sent this to me yesterday. And so I think that the momentum is there and we don't want to be last. And there's a variety of different programs out there that are evaluating the efficacy. And Gus Schumacher is a namesake program, the GusNIP Nutrition Incentive Program, has been funding through the federal level programs to test and evaluate the efficacy of these programs, mostly with very favorable outcomes. And now the White House is doing it. So we started this work a year ago. There was a bill. We had lots of favorable attention to it, but now the Biden-Harris administration has convened this conference that they're hoping to drive solutions to these challenges. And these challenges, I hope that there's a ton of momentum that happens out of the federal administration behind these issues, but Connecticut is different than states that are mostly rural or states that we have unique challenges, and we can have unique solutions that can piggyback and improve the efficacy of federal efforts. And we don't want to wait for them to be the main impetus for our solutions. So what I'd like to do is to spend a little bit of time, and I realize this sort of talking about what the expertise of the different agencies are, and what's happening and what makes the most sense as a starting point or a spring point. And then we can sort of go through. And I thought it would be best probably to start with the agencies, because they have a good idea of what our capacity is as a state. And so the first thing that I would like to do is put sort of the conversation out to the agencies to tell us about what they think is happening right now and what is a good ground for what could happen next and future directions. I don't know if it would be best for me to say an agency that's doing things, because I know you all are. So what are people doing now at the state agencies that would be good groundwork to include in future efforts and to leverage?
I know our sister agencies are always shy, so I'll jump in and let them come in. And but there's a lot of talent on here, so I want to make sure they all get a chance to talk about what's going on in their respective worlds. We at the Department of Agriculture funded through our ARPA allocation, the federal ARPA allocation, SNAP doubling through End Hunger Connecticut. So we have covered 100% of the matching requirement. And we did it in a way that would allow for the match to be extended beyond just fruits and vegetables in a produce doubling component, as the traditional GusNIP model has. Relatively small dollars, $250,000 or $200,000, I apologize, that was contracted with End Hunger. And that covered all of the participating SNAP doubling farmers markets, which I believe there are about 30 of, and allowed them to expand. We think we'll get 2 years out of that funding. So obviously, not every farmer's market. We recognize also that people buy food not at farmers markets. I strongly encourage everybody to go to a farmer's market. But if you don't, that's okay too. We also have our farmers market nutrition program. We expanded the value of those. Thank you to the legislature for agreeing to that, to $32. So seniors or families that participate in the WIC program can go to a farmer's market and have $32 essentially free to spend on fruits and vegetables. It's a great program. Our senior implementation and adoption rate is huge, 80+% every year. WIC is significantly lower, but we continue to work on that with outreach and our public health partners out in the field. We have just applied as of literally last night a electronic WIC program. So we'll move from a paper voucher program, which I think we all recognize is pretty clunky. So that was a $250,000 federal application that we submitted. So that could be real dollars back into this program. Those are a couple things that we've been working on. The Food Policy Council recently took a vote to pursue implementation of a healthy food incentive program, similar to the Massachusetts program, for SNAP doubling at farmers markets. I know Massachusetts, and we brought somebody in previously to talk about what Massachusetts was doing, but they piloted it at farmers markets. They moved back, I believe, to groceries, or I'm sorry, they piloted at farmers markets and grocery stores. They moved it back to farmers markets, given the amount of money that was being spent or invested, depending on how you look at it, in families. I think it made the program a little unsustainable. We also, in our other non-SNAP doubling or WIC programs, funded through Food Share and other community food partners, between CRF, ARPA, and the local food purchase agreement, probably close to $5 million at this point that's been contracted out for food banks, food pantries, nonprofits, healthcare organizations, to purchase Connecticut grown goods for distribution. So the direct purchase of fruits and vegetables from Connecticut farmers to be used in emergency feeding relief efforts, which I think, to your point earlier, Representative Foster, is a great way to make sure that that we recognize the value and the benefit across the spectrum. It's not just about the individual that's getting the benefit of having access to great food, but there's also an economic component that supports Connecticut small businessmen and women in our ag field. So a couple things that DOAG is working on. I'm happy to share more or share out any of the information that I talked about, but that at least will kick off where we are from an agency perspective.
Thank you. And it would be helpful if you wouldn't mind sharing those things. My commitment to this group is to try and keep us making steady progress moving forward ahead of this legislative session, so we have something that makes a lot of sense as an introduction standpoint that builds on what our agencies are already doing. So if you share that and all the other agencies do the same, I'll make sure that what we introduce isn't something that in public hearing we have, well, we're already sort of doing that and we should have leveraged something differently, that we were making sure that we have interagency buy-in and consensus on where we are and where we're going ahead of this meeting. So thank you so much, Commissioner. I am wondering if DPH would like to go next.
Yeah, sure. So as far as the agency perspective, we aren't currently working in this realm of food as medicine or vegetable prescription programs. We have several nutrition-related units within our agency. Currently, there is the Women, Infants, and Children program, also known as WIC. We also have a program called Wise Woman that addresses nutritional education and services for women at risk for breast and cervical cancer. And then there's my unit, the Nutrition, Physical Activity, and Obesity Prevention Program, which is primarily federally funded. There aren't really any state dollars that are being utilized for nutrition programming. So our unit is really tasked with implementing the objectives of our federal funders, which, depending on the program, there's a variety of different ones. But in a nutshell, we have a SNAP Ed program from the USDA FNS. We also have a USDA Farm to School grant where we work with early care and education providers. And then finally, we have funding from the CDC to implement our SPAN project, which is the State Physical Activity and Nutrition Program, where we work on several initiatives, primarily on increasing nutrition and physical activity standards in preschool, increasing food and nutrition standards in work sites and community settings, and also improving breastfeeding promotion and support. So although there are opportunities for us to partner, federal dollars are pretty much tied to the specific objectives that we have in these grants. And then one final thing I think is worth noting is there is a state health improvement plan that is being directed by our agency. And there are several strategies or objectives within that plan that address housing and food security and nutrition. So that might also be an opportunity to make some connections as well.
Wonderful. And if there are people who are part of that would be helpful for me to meet with and sort of convene and figure out the best strategies, that introduction would be helpful. Thank you very much, Jennifer. I do want to point out from my experience in reading the literature, that there is this sort of missed opportunity in a lot of the produce prescription and nutrition incentive research, where I see a lot of times in studies, there is a linkage for nutrition education, but then when it goes to long-term sustainable funding, there is not a consistent link. And we see this in SNAP-Ed and in FNEP also in our state, where it is encouraged for SNAP beneficiaries to participate in those programs, but there is no requirement. And I am not inclined to require those education components, but if there are ways that we can think of ensuring that people sort of maximize the benefits between the education programs like WIC and FNEP and SNAP-Ed and the programs that are related to providing the food, I think we will see better outcomes for the people of our state. So that's something I think worth considering.
I think I'm so glad you brought that point up. When I was doing some of my research earlier this morning, that was one of the things that stood out to me as a potential for collaborating with our SNAP-Ed programs. I think there's 5 or 6 of them across the state at this point, and we do oversee one of those implementing agencies. So I'm so glad you brought up that point.
Thank you so much. I am wondering if it makes sense to go to DSS and then OPM, sort of have that lineup on deck.
Sure. So I would generally defer to our SNAP manager, but he's on vacation. So I can just run through a few of the things that DSS has been doing over the pandemic to address food insecurity. We've been increasing monthly allotments to SNAP recipients, bringing them up to the maximum per household size. So that's been one of the bigger things we've been able to do. It's increased the amount of SNAP money we're giving to the community by millions of dollars per month. We have also been providing PEBT to school-aged children who might receive free and reduced price lunch. That's been a lift. We've been working with the Department of Education to identify those students. So I believe that's going to be continuing, but I'm not sure on the timelines. And so I'll check back with our SNAP manager when he's back in the office and get some more details on that. And there's also just ongoing efforts to expand online purchasing options to new stores. I think most recently Geisler's was added, multiple locations throughout the state that folks on SNAP can purchase online. So that's been happening mostly over the last few years. It's been a helpful thing for those folks who might not be able to make it to the grocery store on an often basis. So a lot of things that we're doing, and I'll take the question back to our SNAP manager to get further details and can share them at a later time, but wanted to highlight those few things.
Thank you so much.
Dave, if I might just build on sort of the cross collaboration. This kind of goes back to Commissioner Hurlburt and some of the comments that Dave just raised on behalf of DSS. Earlier this year, in collaboration with the Office of the Governor, we convened a small working group on this topic that included DSS, Commissioner Hurlburt from Department of Agriculture, and colleagues from OHS to discuss both the development of a proposal for additional ARPA funds in the food as medicine space, and then also just more long-term proposal. And we focused on the food prescription programs as well as funding for diabetes prevention programs that are already sort of well-established through the CDC pipeline that we could incorporate into this programming, as well as some green space development that would kind of complement some of the work that the Department of Agriculture is already doing to connect urban centers with fresh produce. So that collaborative work resulted in a proposal to OPM for ARPA dollars, which ultimately was not funded, but I think that it has some good bones in it that we would, probably be willing to share, and memorializes the kind of experts around agencies coming together on this topic on what would be possible, and would be happy to share that with the group.
That would be wonderful. It also sort of harkens that I'm that Connecticut Innovation has a food as medicine VC effort that I'm aware of that is like now tickling my memory as we're talking about this. And so that is another sort of conversation, perhaps. I don't know who would be the best linkage to that, but maybe Claire, that would be something that we can connect on and bring into the group. OPM and then aging, if that's okay. I don't know who from OPM is best, if you'd like to share thoughts.
So Representative Foster, as you know, not being a line agency that actually administers program, but managing the budget across different agencies and the policy and program evaluation of those programs, our work has mostly focused on making sure that those ARPA proposals that do relate to nutrition, including there's new plus up of dollars, $3 million for Meals on Wheels and elderly nutrition. Those are scoped appropriately coming out of the pandemic to meet unmet need among our elderly who rely on that for healthy food and nutrition. We also have some other programs through SDE that we're working with those agencies to frame up, and our ARPA unit is making sure that we find eligibility pathways and then collect information and do the necessary reporting to the federal government of what's working, what's the ROI on those programs. Apart from that, you probably are aware from the roles that you sit on in the legislature that we're also in the depths of our federal block grant process, and some of those federal block grants obviously have opportunity to fund meals and nutrition programs, including the social services block grant. So we are working through what's worked in the past and framing up those block grants for transmittal to the legislature probably in the next week or so.
Thank you.
And I don't
so
know
much.
if any of my colleagues anything else to add from either Judy. Okay, we're good. Thank you.
Thanks so much. Aging?
Yes, this is Janet, and I oversee the elderly nutrition program, as I mentioned earlier. And what we're currently doing, we do the congregate and home delivery meal program. And with that, we do standardized meal, but we do have some specialty meals like renal diets. However, we do not individualize those at this moment. And that's something that we're currently looking into as far as medically tailored meals so that each individual will have the diet that is necessary for their health. One of the drawbacks we do have, as you probably know, funding and also the resources to do so. Most of our providers do not have the ability to provide those individualized meals because of their capacity, and also the staffing to do so. So that's something we're looking into as far as if there is an agency. I know one of our E&P providers is now utilizing one of the hospitals to provide the medically tailored meals for their participants. So we are looking to see if there would be funding or collaboration among all the other providers, elderly nutrition providers. So if there's one larger two facilities that will be able to provide that for the participant, then we would be able to utilize that resource. We do provide nutrition education to all our participants if it's if they accept it. We don't force it on them, but it's available to all of our participants. However, due to funding, we would have most of our providers would rather provide the meals because that's an additional cost to get a dietitian or nutritionist to do that educational piece of it. So we are in the process, and hopefully in the future, we'll be able to do more of that. But we try to do that both for home delivery and our congregate participants. It's required that each provider provide at least 4 sessions of nutrition education to all the congregate meal participants. So at least if they're not there every day throughout the year, it's available to them. And we do provide material handouts in support of the presentation that they do. And just one thing, and we did get additional funding through DSS through the social services block grant, which was an additional resource that we are utilizing to provide additional meals for home delivery meal participants. And along with that, and I don't do that program, but we do have the chronic disease self-management program, which one of our staff person manages. So that is something that we could also use to strengthen our force to provide better nutrition and food security for our participants.
Thanks so much, Janet. Lucy, Rep. Dathan, you want to just?
Yeah, I just a quick question, and sorry, Rep. Foster, for letting me jump in here, but I came across a study that was released recently about the linkage of Alzheimer's to eating less processed, more processed diet. And so this study did a huge exercise, and it said that folks that have a least amount of processed foods in their diets and more fresh fruits and vegetables had the lowest instances of Alzheimer's. And I'm wondering if there's any dollars associated with Alzheimer's prevention that could be utilized in our aging community to help with this.
So I see Rafael has his hand raised. I don't know if you have a question or a thought on that.
No, just I'm very glad this study was mentioned by Representative Lucy Dathan. I'm not sure if I'm pronouncing your last name correctly. This is actually a study I'm very familiar with. It was conducted in Brazil. It was a 10-year follow-up cohort study. It was very, very well done. And essentially what it does is to really bring to the attention that the consumption of ultra-processed foods, those that are very high in energy and very poor in nutritional value, essentially not only affect physical health, such as hypertension and cardiovascular disease and type 2 diabetes, but they also affect mental health. And what is very telling from that study is that they estimated that it only takes 400 calories per day for this to happen. And the public needs to understand, and decision makers need to understand, that this is the equivalent to 2 medium-sized chocolate chip cookies per day. It doesn't take a lot. So I think that is a type of evidence that hopefully decision makers can receive, so that they understand what we're talking about. Plus the fact that almost all these studies start with adults, but we know that the consumption of these ultra-processed foods and sugar-sweetened beverages pretty much starts since the beginning of life. So there is also a need to don't forget that the prevention of many of these conditions from food security, nutrition security approach needs to start since gestation, since mom is pregnant. So over to you, Representative Foster.
Thanks so much. So I was going to go through, I have 3 more agencies that I think I have listed that haven't gone yet to share. My goal, I want to keep to our time goal for today. So I just want to sort of frame where we are. So my goal is to set a benchmark for where we are, and then also talk about where we need to go. And I still have academic and nonprofit and healthcare organizations represented. So I'm going to list a couple more of the agencies to sort of tell where we are. And then what I'd like to hear from the nonprofit and academic partners next is what you think the state of Connecticut needs to be thinking about as they are talking about food as medicine. So I didn't yet get to the Commission on Women, Children, and Aging and the Office of Health Strategy. Do you have thoughts on this?
Thank you. I do. That last set of statements from the doctor was really compelling, because it just reminds us of the link between poverty, especially multi-generational poverty, food as prevention, and the best information that families can have as prevention as well. And I just want to make sure that we don't miss the opportunity to really invest in prevention. And how do we do that? And I love the idea of having a prescription for good food, for good, healthy food. Because on the one hand, it teaches about good, healthy food. It's a direct option for families that are struggling, and it keeps us away from some of the more detrimental diets that are, by the way, the reason they're so accessible is because they're cheaper. They do provide all of that immediate energy. And of course, people are struggling. So those are just some of the things that are stimulated in my brain. As you know, we're a policy shop. We're not an implementation shop like some of my colleagues. So I'll just leave it at that.
Great, thank you. Office of Health Strategy, Brent Miller.
Yes, good morning, everyone. So at OHS, what we've been focused on is social determinants of health and health equity, and really trying to shift that paradigm of focusing to upstream root causes. So when we talk about prevention, that really resonates with me, because those are the items that are causing poor health downstream. And we're really trying to let communities tell us what the issues are in their communities, and then the solutions that work for those communities. So to give you two examples, we received a grant from the Federal Office of Minority Health, and one of the items we focused on is maternal health, right? The health of mom will probably impact the health of baby. And so we've been trying to work with the local communities, faith-based organizations, community-based organizations, a hospital as well, on what are the correct solutions, such as using community health workers, doulas in New London and Middletown. We've also been working with the Mashantucket Pequot Tribal Nation on food insecurity and listening to them on what they need in setting up a farmers market, as well as setting up a food incentive program. I heard this earlier as well. Probably our biggest challenge is, this is something we typically don't pay for, right? Are those social determinants of health, and trying to find that sustainable funding that ultimately will allow people to address the root causes that are leading to their poor health.
Thank you so much. Did I miss any agencies? I don't think I did. Okay, hearing none. I'd like to now turn towards people who are doing research and programmatic work in either the nonprofit, academic, or clinical setting. And I know that there's a variety of these out there. And so for any of those academic, nonprofit, or healthcare organizations who are part of this conversation today, do you want to share? And I'd like to ping for the Connecticut Hospital Association. I think the Unite Us platform should be something we think about, making sure we leverage in these conversations as at least referrals as being part of food as medicine. So I'll just plant that seed and then see if there are folks who'd like to share and talk. Jenny and then Megan.
Thank you, Representative Foster. I'm gonna keep it brief. We have a unique opportunity to actually share some perspective from people with lived experience, because we recently conducted some listening sessions ahead of the White House Conference on Hunger to make sure that those voices were heard and included as part of a larger report. And really the feedback we received loud and clear, and what we heard people share most often that was preventing them from thriving, which is really how we framed the conversation, was access and availability to just general healthcare, and also ability to access resources and exert control over their own health. So things like access to produce, lifestyle changes they might be able to do. We had a conversation where one individual shared that they were part of the Silver Sneakers program that they can get through public health, and another person, while they received public assistance, didn't qualify for that program, but wanted so badly to kind of engage in something like that, where they could find a sense of community, people who share their experiences, and they could take back that sense of ownership and control over their own health and their own direction. It's part of what we try to encourage through our SWAP program, which really just makes it easier for people to make their own choice about the healthy food that they know they want access to. And I know Commissioner Hurlburt mentioned earlier the local food purchasing program that we are very, very grateful to be a part of, but it's really enabled us to not only stimulate our local food system and the local economy, we're also able to shorten the supply chain and make sure that we're getting that really fresh, nutritious local food out to people at peak freshness. They're getting a new variety. There's all sorts of different things they're trying and have access to. And I think from the perspective of, what at a policy level can be done, it's anything that can continue to support and expand and build on those programs really makes a marked difference in people's day-to-day experience. Thank you.
Thanks so much, Jenny. And I think I should point out that many states include as a consistent part of their state budget collaboration for fresh food purchase as part of the emergency food system. Our emergency food system has a significantly smaller, though significantly grown in recent years. I think many thanks to Commissioner Hurlbert and advocacy of ARPA dollars, but there has historically been a much smaller state investment in fresh food purchase in our emergency food system in Connecticut compared to other states. So I think that's something to draw attention to. Megan?
Thank you, Representative Foster. Appreciate you calling out the Unite Us platform as well. I just wanted to highlight those pieces. So, all of our hospitals are planning or participating in efforts to screen for social influencers of health or social drivers of health. So food and nutrition and security are certainly a part of that screening. And I think those are fantastic efforts and opportunities to tie into with some of the work that's been mentioned so far. In addition to, using the Unite Us platform, there are other platforms being used, but it certainly enables the screening and then the referral and the closed loop to understand if, people received connections to food services. And the other piece that I wanted to highlight is we are in that spirit of really moving upstream and looking at root cause drivers of health, focused on, I think, Stephen's point around poverty and economic mobility and opportunity as really being a large driver of food insecurity and nutrition insecurity. So thinking about hospital partnered and hospital led initiatives around economic mobility and health as really opportunities to improve food security. So we're currently working on something we do call the Economic Mobility and Health Initiative that's very focused on people who are capable of getting pregnant or newly postpartum. So hopefully there will be time at a later meeting for us to talk more about those initiatives.
So I'm cognizant that there's a lot of great work happening and there's a lot of great potential. And so what I'm going to try and do as I hear the feedback and comments that are coming moving forward is I'm going to try and figure out the best structure to make sure we leverage this collective expertise and the voices we're missing in this room to make sure that come January, we're in a position where we have a really robust proposal that really values all of this shared expertise. Lonica?
Thanks, Rep. Foster. There are a couple of things that I'd like us to keep in mind as we're moving forward that I think the state could keep in mind. My body of work really focuses on behavioral weight control interventions with a special focus on health disparities from a racial lens. But I'm encouraged to hear our focus on, really addressing disease through nutrition, but often obesity is kind of a midpoint between what we're eating and getting to disease. And so given that that's just a persistent public health issue, I want to make sure that we do leverage opportunities or programming that might already exist that does focus on obesity, whether that be from a prevention aspect, which often is for children, but also, from a weight reduction aspect and a treatment aspect for adults. That makes me also think about where do we have registered dietitians already part of the stream of really addressing obesity. Those can also be opportunities for creative work and policy development. And then lastly, just thinking about the context of where food actually is and where it's not. Somebody already mentioned, the environment and access to food as an issue. So I want to make sure that as we're thinking about prescriptions and other creative ways to address this issue, that we are also thinking about the access point and what we may need to create in that space, or just make policy that is friendlier to opening up that space for fresh fruit and vegetable access. Thank you.
Thanks so much, Lonica. Heather?
Thank you. That is perfect flow into what I was going to share. So I think ease and access is so important. I am here wearing one hat, but my other hat is 16 years experience as a SNAP Ed educator. And so I would say inviting some of those folks to the room would be really beneficial, but also where I've seen the best redemption of produce prescription as well as incentives is when the market is right there. So I think of Bridgeport when the WIC was, right next to the farmer's market back in the day when Wholesome Wave had the farm stand. Moms would come out of WIC with their voucher in hand and the market was right there. Danbury Senior Center, the seniors complained that the market was on Saturdays. They didn't have access to transportation, which was only Monday through Friday. So they moved the farm to the senior center. So be thinking of, what are small changes we can make, but redemption goes way up. People are buying, they're using those vouchers to make those purchases of fruits and vegetables because we've made it easier.
Wonderful. Thanks so much, Heather. Sally?
Yeah, thanks, Rep. Foster. Just, two things I wanted to stress. I did want to talk about the food environment and making sure that we look at access and easier access as we're addressing these issues. That's all our research is looking about. How can we change the food environment to make it easier for folks to access healthy food? And second, thinking about building in evaluation or ways to understand how these programs are directly benefiting folks would be really key, I think, to one, establish these programs in the state, but also encourage long-term funding. So just wanted to bring those two issues up.
Thanks so much, Sally. Kathleen?
Thank you. Going off actually what Sally just mentioned, we are focusing on working with Wholesome Wave, actually with 2 produce prescriptions right now outside of the state, and really evaluating it for outcomes and who the program works for and who maybe it doesn't work for and why. But one thing I did really want to point out is our interest in also focusing on the implementation and how these programs are implemented. We'll be working on an incentive program in Hartford coming up later this year, really co-designing the produce prescription programs with residents and people who are in the program. So ensuring that the program is built with and for the people who are in the program. So really looking at the implementation too, I think is part of what we should be thinking about as we're thinking about policy, that it really is respecting the people who are part of the program.
And I should mention that in future meetings, my hope is that one of our guest speakers will end up being, we can recruit witnesses to hunger, or we can talk to Connecticut Food Share for making sure that we're getting those voices represented separately. And so that'll be hopefully one of the meetings that we have between now and session. And also the public hearing would be a good opportunity when a bill gets introduced to have that opportunity. Brent and then Nancy, and then I'll try and close out as swiftly as possible. So Brent.
Yeah, just recognizing the time, I'll be very, very quick. Across the country, more and more states are working with CMS to reimburse food as medicine in their Medicaid programs, and it should be at the center of what we're talking about here as well.
Thanks so much, Brent. That is my hope. And Nancy.
Yeah, really quickly. So I do think that there is this opportunity to really connect food and health. And that's where obviously like hospitals and clinics, and that's where, healthcare facilities should be part of this, I think part of the solution. And, Hartford Hospital has now opened their food pharmacy. They're trying to, and, they've connected pregnant women and people with diabetes. We're at Connecticut Children's have we're a really kind of pilot feasibility program of, screening in the emergency department and working with Hartford Food Systems to actually what Kathleen was saying, to have, or somebody was saying, something right there. So when people leave, like with their prescriptions, like there is, a place for them to redeem them right there. And I think that, that ease of access is really crucial. But that would be my point of just really trying to, reinforce the how good nutrition, healthy foods are absolutely critical to health, and connecting that with healthcare institutions. Thanks.
Thanks so much. So I'm cognizant of the time. And so what I would like to say is we will announce upcoming meetings via email to this listserv, but I'm hoping that folks can share with me via email things that they shared today and expansions on that so we can share that with the group to increase our efficacy moving forward. My hope is that in every meeting moving forward, we can have a central topic that people can share their expertise on. We can have a presentation to kick off the topic, and then we can share. And so I will be soliciting that feedback based on sort of where we are and where we're going, so that in the meetings that come next, we can really sort of hone our direction now that we sort of have an idea of who's in the room and who should be in the room. So with that, before I adjourn the meeting, I'd like to see if Rep. Dathan or Rep. Kennedy have anything else to add?
No, I think it was great. I think we might need a little more time next time because this has been a fabulous conversation, and so many people had so many good things, and was just so happy that everybody came to the table. So thank you again.
Thanks so much. Rep. Kennedy, go ahead.
And I too thank you, Rep. Foster. This has been very informative, very enlightening, and I think we have a lot to cover. So I agree with Rep. Daltham. We're going to meet a little more time next time, but I'm looking forward to it. And I'm going to read through everything that you'd sent us yesterday. So thank you, and this is great. Everybody have a wonderful day.
Thank you, everybody, so much. I really appreciate everyone being on the call and allowing me to have the synergy between my two heads and my two roles. It was nice to see so many people in the same room, Zoom room, and I look forward to our next meeting, an opportunity to get together. Please don't hesitate to send anything my way, and we'll work on creating a path for moving forward. Thank you, everyone, for being a part of